colleagues, my name is Dr. Andrei Covaci. I'm a plastic surgeon from Romania, and in today's session I'm going to try to embed the presentation of our lovely patient, the assessment, the facial aesthetic assessment, the drawings, and the injection technique. Hopefully, if she's going to give us her 20 minutes of her life, we can reverse her age with approximately 5 years. I hope you're going to enjoy it. Good, so in front of us we are having our patient, that is a female 41 years old patient. On the assessment of the face, we're gonna notice that she's having a round oval form of the face. Also, her skin quality is pretty good. She doesn't have any skin condition or any spots that can stop us for doing the treatment. So planning for the injection or for the treatment will be to make sure that we get rid of this sagginess. So this sagginess, it is the lack of volume on the middle face. Also, sometimes I like to assess the facial expression. I'm gonna try to ask the patient to mimic something. Dă un pupic, zâmbește așa tare, dă un pupic, zâmbește, încruntă-te, strâmbă-te. Okay, good, that's good. Because always we have to keep in mind that we have to, let's say, assess the dynamic of the face. We don't want her to look good only when she's staying. We have to make sure that she's looking good when she's speaking, when she's, I don't know, having all kind of gesture, facial gesture. Good. So in order for us to solve this problem, as I told you, we have to make sure that we leave the tissue on the medial part of the face. For lifting, we have the best product in the world, that is Restylane Lift. It's gonna stay where we're gonna put it, also will not attract water. That's the reason why my product of choice will be Restylane Lift. The nasolabial fold, the last 2 years I'm using 1-point injection technique. It is a bolus technique, it is a profound one, and I know that even if the medial part of the face is more expressive and we are tending to use OBT technology, because I'm going to use the product deeply, I need just the lift and the projection. I think will be more than okay. If I would try to go more superficial by treating the nasolabial fold, I'm going to use definitely OBT technology like Restylane, Define or Voline. Good. And once we treat this area, we're going to see an improvement of the jaw line, the anterior part of the jaw. In the end, I still think that we're going to need a little bit of definition in this area. The reason why I'm going to switch the product to Define, since I'm going to inject it more superficially. So in this situation, I'm going to use Define, Restylane Define. It will be just a small part. I'm not going to do the entire jawline. I'm just going to do the, let's say, chin to the middle part of the jaw. And I think that will be with the assessment and the treatment plan. We're going further to the drawings. Skipping further, we are now at the drawings. I'm gonna try to make a quick draw about anatomy, about the danger zone. Starting with the drawings, I'm gonna try to see where we're gonna have the arterial insertion. So I'm gonna ask the patient to bite. Can you bite a little bit? Good. So I can feel the muscle. So in front of the masseter muscle, basically here is the place where we are having the arterial flow. Okay, it's going up through the nose, having some bifurcation here, going with the lower labial artery and the upper labial artery. Also, at this point where the nasal outer part it's inserting, we're going to have the nasal part and the outer segment going with a tonic segment. Here at approximately 1.5 centimeters, we're having a foramen that we're having suborbital foramen that is going to give us some vessels. Also, the venous part is the same, like arterial part is going related to the artery vessels. We're going lower labial part, upper labial part, and nasal part, and have the angular part of the artery. We are also identifying, or we are trying to imagine, the fat pads that we are having. So one of the fat pad is the nasolabial fat pad. Also we have medial fat pad. We have lateral fat pad. We have suborbital fat pad as well. This is the superficial part. We're gonna have some mandibular fat pad as well. Going further again, I'm gonna show you my injection technique and what I choose in my approach. For this, I'm gonna switch position on this other side of the patient. So, because we want to augment the anterior part of the cheek, we're gonna have a cannular approach. So the insertion point will be very close to zygomatic arch, and I'm gonna try to advance with the cannula and let the product in the area that I want it to be. Also, I might use the fanning technique, but because we have a very strong product, I'm gonna try to be as precise as possible. Regarding nasolabial fold, because we have this area, the danger zone of the injections, a lot of vessels are in this area, we're gonna switch from the cannula to needle. I'm gonna use the needle with a deep approach, aspire and inject the product. Again, on the lower part of the face, I'm gonna need some definition, and I'm gonna switch again to cannula. I'm gonna have the insertion point in front of the masseter, and I'm gonna advance with the cannula and try to get a straight line as much as possible. I'm gonna use the product retrograde, and I'm not gonna aspire too much in this area since I'm gonna be superficial. Okay, they have a very interesting approach, and it is easy to see that we're using lift, light blue color. Okay, so we're gonna have that approach here. Okay, good. No pain. So you can see the tip of the needle, the cannula, sorry, and I'm just gonna let a little bit of product there. You can already see the improvement. The magic part of this treatment is that with less volume or less product, we're gonna see a very nice and decent result. Okay, so we are in the medial fat pad that we're trying to augment. Okay, good. I'm going to use the fanning technique as well here in order to have them shape that we want. Always keep in mind that you have to feel the hand of the cannula. We can massage it to make sure that it stays in place. Already see it. Good. Okay, thanks. A little bit more. So I'm going to use one nail on this side and another nail on the other side. Hopefully we're not going to create any bruisings. okay? Can you stand up a little bit? Good. So we're gonna go further and make a little bit more. We have 0.2 left. As you can see, I always want to make sure that I am seeing or I am feeling with that other hand the tip of the cannula. Now it's easy to see where I am. I am in the middle fat pad. Now when I'm retracting the cannula, I will be in the lateral fat pad. So from time to time I will just massage it to make sure that it's in place. Good. A little painful? Not so bad. So we can stand up a little bit in front of the camera and we can see the difference between left side and right side. We have already improved this part of the cheek and the area. Good. We can easily assess it with this part and this part. So, put a little of that. Now we can see on the lateral part to feel the increased volume of the cheek and the other part. I think more will be noticed once we're gonna correct the other part as well. Good. This is pretty good. Okay, now we're gonna have nasolabial fold. So I'm gonna do a bolus injection technique. Again, we're using lift. I'm gonna have a deep approach. I'm gonna clean the area. I'm gonna feel the needle. Good. You feel it on your bone. Is it okay? Any pain? Acceptable. Now we can do aspiration just to make sure that we don't have any blood. And now we're gonna slowly inject the product. If you're noticing any pain or anything, just let me know, okay? You're gonna hear some crackles, but that's fine. Is it okay? Interesting approach. Some of the patient experience that they're gonna have the numbness of the upper lip. Poate să-ți amorțească pulsa de sus. Okay. Slowly, as slower as you go, the less pain you're gonna create. I think this is it okay? I don't think I'm gonna use the entire syringe because we've only used 0.4 and we already have the result that we wanted to obtain. Good. Once again, we can raise and you can see the improvement on the right side from the left side. Again, light approach, the same patient, different products. Okay. Okay. With the rest of the product, I think I'm going to use it to advance a little bit more in the product. Yeah, so okay. 0.1, I'm going to use it here, the anterior cheek line. I have to feel the zygomatic bone. I'm just going to stretch and inject.
Aveți că tu n-ai zis pe partea cealaltă că o să faci asta.
Nu am zis, dar am zis că a rămas till we have, so now we have half of the syringe. The same thing will go on that other side. We're going to use 0.3 for the nasolabial fold. So normally we are tending to use more product, but this is the magic of Restylane Lift. We are only using less product and you're gonna have maximum effect on this part. Good. Going further, okay, we can lift. Now we are approaching the last part of our session, the jawline definition. So we are already seeing the improvement, the less sagginess on the right side than the left side. So with this part that will be treated finally, we're going to complete our half face treatment. Now we can sit down. Thank you. Good. Nu vă rog la cadru, nu?
Acum ești, da.
Okay, again, we have switched to the cannula. Now the product will be defined, Restylane defined. Again, this is the OBT technology. This gel is giving us the chance to have more expression. It is more flexible and it will stretch when we need to be stretched. Okay, again, we're gonna do approach. Can you make a bite? So here is the insertion. Here like this. Here should be the insertion of the facial artery. I'm going further a little bit. Do this approach with a needle. Good. Now the area that we want to treat is from here to here. Okay. Any pain? A little bit. Good. So I'm in deeper layer of the skin. I'm just gonna advance and after that inject retrograde. So the tip of the cannula is right here. I'm gonna let the product slowly, again, we don't have to rush. If you're feeling any pain, just let me know. Adriana, are you okay? Good. The OBT technology and define. The product that we are using now is for definition. So again, I'm gonna try to lift a little bit. What I like to do after the injection, especially when I'm superficial, when I'm not too deep with my fillers, is to help them integrate in the tissue by massaging them. So that's what I'm... Because we have cleaned the patient, we can definitely see much better the big difference that we did with only 2 mils per side. So again, we have improved the zygomatic arch, the chin, the anterior chin part. The nasolabial fold is resolved with only 1 point of injection. Also, with half of the syringe, we did a better definition of her anterior jawline. So we can see the difference between this part, the left side that is not injected, and the right side that we are already injected. So this is the safe approach. Again, the cannula approach was from here, here is cannula, here is cannula, here is needle. So just 3 points of interest and we did it. We're gonna clean it again and we're gonna see the result 3D, moving the patient from a part to another. Again, so we can see this part. You can see this other part. Definition of the jawline, the zygomatic arch that is improved, and the nasolabial fold. So in the end, mission completed.